All right, joining us now is Tareq Hailat. He's the Director of Global Patient Affairs at the Palestine Children's Relief Fund. He joins us live from Washington, D.C. Tareq, thanks so much for being with us here on Al Jazeera. We appreciate it. First, I want to ask you your reaction to this decision from the State Department and what kind of impact this will have on the patients from Gaza that your organization helps to get care in the U.S.
Well, first of all, thank you so much, Mohammed, for having me. This is an extremely devastating news. Obviously, we heard about it today. The impact of this decision will be devastating, and the U.S. must honestly reverse this decision immediately. Blocking medical visas from Gaza, including for critically injured Palestinian children, is straight up denial of their most basic human rights. These children, they can't get adequate access of medical care inside of Gaza, and due to that, we have to medically evacuate them. And to then not allow us to also medically evacuate these children, it will really limit the amount of care that we can provide children that need basic human rights and basic medical rights.
Tareq, could you speak to how many patients we're talking about when it comes to the number of Palestinians in Gaza that your organizations and others are able to get or were able to get to the U.S. for treatment, and what kind of treatment options have been available to them?
Yeah, so we've tried to ensure that we have backup plans, and so we've now become the largest medical evacuation program out of any other nonprofit organization. And we've evacuated more than 250 children, which, if you think about it, that is a drop in the ocean. But even with that, we've tried to expand where we medically evacuate these children to not just the United States, in case this type of decision does happen. So we've medically evacuated children to Europe, to local regional countries like Qatar and the UAE, Jordan, Lebanon, and we opened up recently the UK, Canada, and Australia. And so while we are worried that this decision will affect the children that we've brought here, which are now up to 23 children, we are also worried that this might spread to other countries who are wanting to also do the same thing. And that's really our biggest fear at this point.
Tareq, considering how difficult it is for Palestinians in Gaza to get proper health care, I mean, we know that the health care system there has been decimated. How important is it for them to be able to access health care in other parts of the world? And how challenging is it to actually get those children or other patients outside of Gaza the way things currently are?
That's a great question, because honestly, it's already difficult enough to medically evacuate these children out of Gaza, but now it's impossible to medically evacuate them to the United States. Prior, it used to be difficult because we would have to get the approval from the Israeli military to be able to evacuate these children out. Now, even if we were to get that approval, we now have to try to also convince the United States government of giving us and granting us visas, which now they're completely denying all people from Gaza, especially these children. And so it's almost impossible at this point.
Tareq, what are the next steps that groups like yours and others can take to actually try and get governments to open their doors more? Or in the case of what's happened in the U.S., I mean, you said that this decision is a devastating one. Is there anything that your group or others can do to try to gain any kind of leverage with the State Department going forward and try to get them to potentially reverse that decision? Where does it go from here?
I think two things. One is that there needs to be advocacy towards the United States government, the State Department, in terms of allowing these children to come and receive this medical care, because there's certain children that can't receive medical care except in high-level institutions like, for example, we brought a child here to Johns Hopkins University Hospital to receive medical care that could not do that surgery anywhere else in the world. And so children that are high risk like that will no longer be able to do that. And so advocating for these children is number one priority. The second thing I would say is hearing from these stories and amplifying the stories of these children. There's children that are here. We have children that are here. I'm currently in Washington, D.C. For an event for one of these children to tell her story. And I think that's a really important point, is to amplify their stories so that people here realize that these are real people and real children that are getting impacted by these decisions. And we have to do something to make sure that this decision is reversed so that other children that weren't as lucky as some of the children that are already here can also receive that same type of medical treatment and medical care.
All right, Tareq Hailat, Director of Global Patient Affairs at the Palestine Children's Relief Fund. Thanks so much for joining us here on Al Jazeera. Great to get your perspective.
Thank you for having me.